What are the do's? First is, as I already told, you have to protect the limb. That is, you are not supposed to bear weight, or you are not supposed to move it in any other way, or manipulate the limb in any other way. So thinking that it's going to be all right. So first one is you have to protect the limb. Second thing is you have to rest that part of the limb. Protect as well as rest it. You're not supposed to strain it. So what do some people do? They think, yes, if I walk still more, if I run still more, maybe the pain is going to be all right. That's a very wrong notion. That's the first thing you have to avoid. And then you have to keep some ice packs every 2 to 3 hours for 15 to 20 minutes. That will help in reducing the swelling and the inflammation and also pain. And you have to give some compression in the form of elastic bandage. That will also help in reducing the swelling. And the last is elevating the limb. You have to keep the limb elevate. So how much do you elevate? The limb has to be above the level of the heart, so the swelling comes down. So these are the do's you're supposed to follow within 24 to 48 hours after the injury. So what are whenever we have a sports injury within 48 hours, what are the things we shouldn't do? So the most common thinking is people either they apply ice or they apply heat pack. So when this is the time you're not supposed to use the heat pack. In acute injuries within first 48 hours, you're not supposed to use heat packs. Why? Because it is going to increase the inflammation and also increase the swelling. So one is heat massage, that is the heat application, that is definitely not to be done. And massages, people usually apply oils or ointments and start massaging the particular part, which is also not preferable, because that is also going to increase the bleeding and increase the swelling as well as the pain. And you're not supposed to consume alcohol in the first 48 hours preferably, because alcohol is also known to increase the swelling and inflammation and cause more pain. And also you shouldn't be giving a complete rest. So maybe first initially 3-4 days the rest should be fine, but after that you need to gently keep moving the part so that there is some sort of stimulation of new blood vessels and the healing starts taking place. So we shouldn't be completely keeping it stiff in one particular position. So after first initial 3 days, then you have to start gently moving the parts. So these are the things. And if you are on blood thinners, you should be very careful, because blood thinners also can increase the bleeding and also cause more swelling. So if you are on blood thinners, please have a close look at the particular part which is injured. And straining yourself at last, and very important, straining yourself. As I already said, like some people have that habit of, okay, if it is paining, let me walk more, it might settle down, or let me run more, or let me exercise more, it might settle down by itself. That is not going to happen. In turn, you are only damaging it more and more. So always avoid straining yourself once after injury, at least for the first 48 to 72 hours.